Laureate's reputation is a reputation of individualized quality care, that we take a patient individually, we know the illness and how the illness works, but we're able to take it in the context of that individual. And we're able to work with families individual with their individual struggles and create a treatment plan that is unique to that individual so that they can carry on and have the best chance of recovery.
What makes Laureate unique is the multiple levels of care that are available. We start at the acute level for a patient who has more severe medical complications and needs that higher level of daily assessment of lab studies, EKGs, and then medication adjustment or psychiatric medication adjustment, higher levels of safety requirement. All of those things are encompassed in the acute level of care. Eating disorders usually have an insidious onset where it's been just gently making its inroads over a long period of time. And when somebody has perpetuated behaviors and long-standing interactions with family and friends protecting their disorder or protecting themselves from their disorder being known, there's been a lot of damage done over time and a lot of behaviors that have become automatic and expected, and that they're not comfortable. They don't know other coping strategies. How else do I deal with my emotions if it's not to go to my eating disorder? And to relearn those things, to address your coping strategies, to address the harms that have been in the family and relearn trust and communication and skills that were probably natural to the family before the onset of the eating disorder, that takes time. If an eating disorder has been in place for many, many years, you can't expect it to be fixed in a short period of time. Even following full treatment and full recovery, somebody's still going to need support, and they're still going to need to work with their families and their outpatient treatment teams following discharge. Families and caregivers are integral to the treatment process. They're with us maybe for what feels like a long period of treatment, but it's actually a very short period of time in the course of the illness and in the course of their recovery. So having the family involved from the beginning to give information, what their concerns are at the time of assessment, and then as the patient is progressing through, to have family therapy sessions along the way, to have the family up for visits. I strongly believe that any adult patient should know what they're taking, why they're doing the steps they're doing, what their diagnosis is, what that means. The more informed a patient is about their own care, the better they can participate in it and also give meaningful feedback about where the care can be adjusted to improve it still better for them.